Good evening and welcome to the clinic. My name is Dr. Late Night. It's wonderful to see you this evening. So you are here for the cranial nerve exam, is that correct? Okay, great. You are right on time. No worries there. I just have a handful of questions for you before we begin, okay? Yes, just some basic information from you. Okay, perfect. So, can I confirm your full name, please? Great, okay. And your date of birth? Yes, that's what we have here. Okay, perfect. And can I please confirm your address as well? Okay, excellent. Great. Okay, now that I have your basic info out of the way, I just have a few questions pertaining to your health and what you have observed about the health of your cranial nerves recently, okay? Great. So, have you noticed any changes in your vision in the last 6 months, let's say? Okay. Of course, we will be testing everything today just to confirm, so no worries, but I just want to know if you've observed any changes in your health, okay? Okay, so, let's see, have you noticed any changes in your sense of taste? Can you taste things that are sweet, salty, bitter? Okay. Alrighty, and what about your hearing? Do you notice asking people to repeat themselves often, or any other problems that you've had? Okay. That is perfect, thank you. Alright, and what about your sense of smell? When you walk into a coffee shop, for example, can you smell coffee? Okay. Alrighty, that is all of the basic information out of the way. So, moving into our exam now, this is going to be very in-depth, so please make sure that you are seated comfortably. Can I get you some water or anything before we get started? Okay, great. Just let me know if there's any discomfort or any questions you have for me during this exam, okay? Okay, great. So I'm going to begin by checking your vital signs. With this stethoscope here, I'm going to listen to your heart and your breathing, okay? So I'm just going to rub it a little bit, make sure that it's not cold at all. Okay. And I'm going to start by putting this on your chest, alright? Just listening for a moment. Okay, will you take a deep breath in for me? Good. Hold it for a moment. And breathe out. Okay, very good. And the other side. Just listening. Okay. Take a deep breath in. Hold it at the top. Okay, and breathe out. Alright, and one more here, just right over your heart, alright? I want you to take a deep breath in through your nose. Good, and exhale through your mouth, please. Okay, excellent. I'm going to move around to your back now, okay? So just take another deep breath in. Hold it. And breathe out. Good. Again, breathe in. And breathe out through your mouth this time. Okay. great. And the other side, around your back. You're not feeling lightheaded at all, are you? Okay, good. Just let me know if there's any discomfort, any concerns at all. Okay. Alright, so one more big deep breath in. Good. And breathe out through your mouth. Okay, excellent. Your heart sounds totally healthy and normal, and your breathing does as well. I didn't hear your heart skipping any beats or any crackling when you breathed in and out, so that's a really good sign. Okay, great. So I'm going to move on and take your temperature here now, alright? So what I'm going to do is just stick this under your tongue, so open wide. Good. You can close your mouth on it. We'll just wait for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Very good. Alright, 98.6. That is right on the mark where you want to be. Good. Okay. Just taking a quick look over you. Great. So I'm going to take your blood pressure now. So if you will just put your arms out. I'm going to do both sides just to make sure there's not a discrepancy, but I don't anticipate that there will be. Okay. So we will start with your arm over here. Just putting the cuff on. Okay, relax your arm. It's going to get a bit tight, but it shouldn't be too uncomfortable, okay? Let me know if it is. Alright, ready? Excellent, that side is normal. Okay, and the other arm now, just to be sure. Okay, so again, relax. Okay, great. That side is just the same, so that is perfect. Alright, I'm going to check your reflexes now with this little hammer here, okay? So just relax your limbs, alright? I'm first going to check your arms. Okay, just go all loose and floppy. Okay, that's good. And the other side, just relax your arm, okay? Excellent, that was a strong response as well. Okay, and then I'm going to do the tips of your fingers as well. So just let me hold your hand, okay? Relax them. Okay, good. And the other side, just relax your fingers. Okay, excellent. Now I'm going to do your knees as well, okay? So just scooting back a little bit. And again, just totally relax. Okay, good. And the other side, just relax. Okay, excellent. Those are all the reflexes we're going to do. Those are the most basic ones and essential ones to check, okay? I am going to, however, percuss like this with my fingers all over your body, so I'll just be listening here, okay? This will not be uncomfortable at all, just relax. Same thing as with the reflexes, okay? Alrighty, so just starting your shoulders here. Okay. Across your chest. Okay, now I'm going to percuss down each of your arms, so just lay them out flat like so. Okay. Great, and the other side as well. Okay, excellent. And I will do the same thing on your legs, okay? So again, just totally relaxing here. Okay, and the other side as well. Alright, excellent. Now the last place that I need to percuss, excuse me for scooching back and forth, is going to be on your back, okay? So I'm just going to reach around and tap on your back. Alrighty? Okay, great. And the other side as well, just reaching around. Okay, excellent job. So that covers all of the basic examination and vital signs. We're going to get into your specific senses now, okay? And we will start with your vision, alrighty? So I have this pen light here. It is a bit bright. Are you sensitive to lights at all? Okay, alright, excellent. I'm first going to take a look at your pupil response, okay? You can just relax your gaze. You don't have to look anywhere in particular. Okay, great. And then I'm going to occlude one of your eyes. Good. Okay. The other eye as well. Okay, great. So you'll just focus right here on the light, follow it wherever it goes. Good. Okay, any double vision with that? Okay, great. I'm going to come in a little closer now, okay? Just pulling down on your eyelid. Can you look up? Good, look down. Can you look to the right? And to the left. Excellent. And the other side, just pulling down on that eyelid. Can you look up for me? Great. Look down. Okay. Can you look to the right? And look to the left. Okay. Excellent, excellent job. Next, we're going to test your peripheral vision. So if you will just look straight at my nose, okay? And what I want you to do is tell me when my fingers become visible to you, okay? Keep looking at my nose. You can just say yes, or you can raise your hand. Alright? Okay. Okay. Good. Good. Excellent. Now just tell me if you see my fingers on the right or the left side wiggle. Ready? Good. Good. Great. Excellent. Good. Okay. Great. Good. You're doing very well. Good. Still looking at my nose. Okay. Excellent. And our final peripheral vision test. We're going to keep looking at my nose, okay? Just tell me how many fingers I pop up on my hands. Okay, ready? Good. Good. Great. Good. Now add them up. Good. Good. Great. Very good. Good. Excellent. Okay, you can relax now and stop looking at my nose. Now I would like to test your color vision. Okay, so we're going to start out with just some solid colors I would like you to identify. I have some paddles here that I will be holding in front of your vision. Okay, and I just want you to tell me what color it is. Alright, ready? What color is that? Very good, okay. What about this color? Excellent. And this next color. Great, okay. What about this one? Good, that one was green. And final color, ready? Excellent, that was red. Very good. Okay. Now these are a more refined color vision test. You may be familiar with them. So what your objective is to just read the number in the circle, okay? This one is a little bit hard, but I'll bring it close to you. Can you read that? Great, 29, okay. I'll just do a handful of these. What about this one? Good, 5, okay. And this one. Good. What about this one? Great. This guy right here. Okay. This one. Good. And just one more here. What number is this? Excellent job. Okay. That is all for the color vision portion of the exam. Alright, next up I have some vision charts for you, okay? going to begin with near vision. So I'm going to hold this about the length that you would hold a book you're reading from your face. So does this seem about right? Okay, perfect. So what I'm going to do is just point to some letters, and I just want you to read them out loud for me. Okay? Easy peasy. Ready? What letter is that? Great. What about this letter? Very good. How about this letter? Great, okay. And this one? Okay. Is it difficult for you to discern between the O and the C? Or is the difference apparent to you, very clear to you? Okay. Now, can you read this letter? S, very good, okay. What about this one? Great. Moving down. What about this one? Z, very good, okay. Let me know if these get really difficult to discern, okay? Okay. What about this letter? Yes, that is an H, very good. And can you read that at the bottom there? L, excellent. And now I'd like you to read this whole line, starting with the L and moving along. Okay, so good. And what is that letter? What about that one? This one? And the final letter. Okay, great. Your near vision seems to be pretty good. However, I do have some more numbers and letters for you to read on the back here. Okay, holding it at about the same distance from you. Can you identify this number? Great, it's a 4. Okay. And can you tell me which direction this E is pointing? This one here in the middle. Okay, excellent. And which direction is this E pointing here? Great, okay. Moving down, this might become pretty difficult, okay. What direction is this E pointing? Right in the middle here. Can you see it? Okay, great. And can you read this letter right down here for me? Or is that too tiny? Okay, yes, it is an X. You did very, very well with that. Now we're going to move to the chart behind me, so I'm just going to readjust a little bit. I'll be pointing to some letters on here, and I just want you to read them out to me, as we did with the near vision chart, okay? So what is this here at the top? What is that? Good, an E. What about this letter right here? Can you read that one? Okay. This one. Great. What about this middle letter right here that I'm tracing? Okay. Moving down. Can you read this letter right here in the middle? This one right here. Okay. And what about down here? Can you read that? Or is that too small? This one right here. Okay. And then can you read this number for me? What number is that? Okay. And what about that number? Can you read that? Okay. Excellent, excellent job. Very good. Alrighty. This is going to be our final vision test, okay? So I have this ruler here. I'm going to put it right up to your face, alright? And what I'll be doing is moving this light to 2 different points on the ruler. And I just want you to tell me if point A or point B is closer to you, okay? Ready? Point A. Point B. Good. Again, point A. Point B. Great. Point A or point B? Which one was closer that time? Okay, great. Now we're going to do the same thing, but I'm going to add a point C. Again, you're telling me which point is the closest to you, okay? Point A, point B, point C. Great. Again, point A, point B, point C. Good job. And again, point A, point B, point C. Okay, excellent, excellent job with that. We're going to move on to the next portion of our exam, which is testing your hearing, okay? So we're going to begin with some tuning forks, so if that bothers you, just let me know. Okay, great. Alrighty. So for this portion, I am going to have you close your eyes if you don't mind, okay? Close them, close them, close them. Good. Now what I want you to do is just tell me if you can hear the tuning fork, okay? Then I'm going to stop the buzzing, and I want you to say yes or just give me some indication when it stops. Okay, you ready? Can you hear that? Good. Tell me when it stops. Great. Okay. And on the other side. Can you hear that? Good. Tell me when it stops. Great. And I have another tuning fork here. So same thing with this one. Can you hear that? Good. Tell me when it stops. Excellent. And the other side. Can you hear that? Good. And tell me when it stops. Okay. Excellent. That is all we're going to do with the tuning forks today. So just a couple more tests with your eyes still closed. I'm going to whisper some things in each of your ears, and I just want you to repeat back what I say. Okay. Are you ready? 17, 32, 14, 45, 17, 32, 45. Great. And the other side. 47, 103, 91. 47, 103, 91. Great. And again on each side. Kangaroo, pigeon, lollipop. What was that? Kangaroo, pigeon, lollipop. Very good. And the other side. Whisper, soft-spoken, ASMR. Whisper, soft-spoken, ASMR. Very good. Okay. The final hearing test with your eyes still closed is to discern between whispering and soft-spoken. So for example, this is whispering and this is soft speaking. So what I'm going to do is speak into your ears some more, and all I want you to do is identify if I've whispered something or if I said it in a soft spoken voice. Are you ready? Soft spoken. Great. Again. Soft spoken. Was that whispered or soft spoken? Okay, good. Don't get tripped up by what I say. I just want you to identify the way in which I say it. Okay? Again. Whisper. Good. Whisper. Soft spoken. Excellent. Just a few more times. Okay. Whispered. Good. Soft spoken. Great. Soft spoken. Good. Whispered. Excellent, excellent job. You can open your eyes for this last portion, or you can keep them closed if that feels more comfortable. Okay. So the last section of our hearing test is different frequencies and being able to discern between them and making sure that you can hear a variety of different frequencies. Okay. So I'm going to play tones all the way from 300 hertz all the way to 900 hertz. And first, I'm just going to make sure that you can hear each of them. And then I will play some paired together, and I'll be asking you questions like which one is higher, which one is lower, etc. Okay. But first, we'll just go through the tones to make sure that you can hear them. Alright? So, starting with 300 hertz, this is what it sounds like. Good, can you hear that? Okay. And 400 hertz. Did you hear that one well? Okay, great. Now 500 hertz. Okay, how was that one? Could you hear that all right? Great, okay. Moving on to 600 hertz. And you could hear that one okay? Alright, great. Now for 700 hertz. Okay, any problems hearing that one? Alright, great. Here's 800 hertz. How was that one? You could hear it well? Okay, good. And the final frequency is 900 hertz. So here's what that sounds like. Okay, no problems with that at all. Great. Okay, now that we have established that you can indeed hear all of the different frequencies I have for you, what I'm going to do is play one frequency and then the other. And I want you to determine if frequency A or frequency B sounds higher to you. Okay, are you ready? This is frequency A. This is frequency B. Which one was higher? Okay, great. And we'll do that again. This is frequency A. This is frequency B. And which one was higher there? Okay, great. Now we're going to do the same thing, but I want you to pick out which frequency is lower, okay? Are you ready? This is frequency A. This is frequency B. Great. And one more time. Frequency A. Frequency B. Excellent job. Okay. Now our final test with these different frequencies is I'm going to play what 400 hertz sounds for you right now, okay? So just listen. Okay. I want you to keep that tone in your head. I'm going to play a sequence of tones, and I want you to just raise your hand whenever you hear 400 hertz and just ignore the rest, okay? So I'll play it for you one more time. Okay, great. You understand the instructions, so let's begin. Excellent. Great, you did very well with that. Good job. Okay, we're going to move on to the next portion of the exam, which is sensation. So if your eyes are still closed, go ahead and open them. Okay, so I'm going to begin by just gently pressing on your sinuses, okay? Any tenderness there? Alright, and what about down here? Any tenderness, any pain? Okay, now I'm just going to touch you on your face, and I just want you to say yes when you feel something. Ready? Good. Great. Perfect. Okay, down here. And here. Okay, very good. I have this little cotton pad here, so it's a very light touch, very gentle. So, can you feel that? Great. Can you feel that? Okay, does it feel about the same here and here? Good. Can you feel that? Okay. Can you feel that? Good. Does it feel the same here and here? Excellent. Okay. Can you feel that there? Good. Can you feel that? Okay. Does it feel about the same here and here? Okay. Excellent job. And finally, I have this metal tuning fork, okay? And I just want you to tell me if it feels hot or cold when I touch you. Ready? Good. Cold. Here. Cold. Okay. And just here as well. And the other side. Okay, do those all feel about the same level of cold? Every time I touched you, did it feel about the same? Okay, excellent. Okay, so now that we know that your sensation is doing just fine, we're going to move on to the movements portion of the exam. Don't worry though, you won't have to get up or anything. This is just some basic facial expressions and movements with your hands, neck, and shoulders. Okay, great. So what I want you to do is give me a big smile. Great, and frown. Okay, I'm just going to feel your cheeks here. Good, can you puff out your cheeks? Okay, I'm just going to tap on them. Okay, very good. You can relax. Go ahead and raise your eyebrows up. Really go for it. And squeeze your eyes really tight. I'm going to try to open them. Okay, just fight, fight, fight. Okay, great. You can open them. Now can you look up for me? Good. Look down. Okay, look to the left. And look to the right. Alrighty. Can you flare your nostrils? Or if you can't, it's no problem, but just try. Okay, very good. Now I would like you to put your head down to your shoulder. Good, and the other side. Maybe it cracks a little bit. Can you roll your head in a circle for me? Good, and the other way. Okay, can you stick your tongue out? Good, and move it from side to side. Okay, great. Can you look over your shoulder as far as you can without hurting yourself? Good, and the other side as well. Okay. Any pain or tightness as you were doing those movements? Okay, good. Now just shrug your shoulders up and relax them. And I'm going to put my hands on your shoulders and just shrug up against me. Okay, good. Very good job. Now I'd like you to put your arms out like this, okay? And just press into my hands. Good. Now pull your arms in and I'm going to try to pull them out. Okay, great. And finally, just some hand movements, okay? So just copy what I do. Alright. I want you to spread your fingers out really wide. Good. You put your thumbs up. Good. Make an okay sign. Perfect. Okay. Can you make a peace sign? Good. Show me your pinkies. Okay. Excellent job. Can you clasp your hands together like this? Okay, great. And can you make two fists? Good. Now I want you to try to open the fists. I'm just going to grab them and resist me. Good. Okay. Roll your wrists in a circle. In the other direction. Okay. Perfect. Excellent job. Okay. Just a couple more sections to our exam here. We're going to test your sense of smell. I'm first going to take a look in your nose with this light, see if I can get it to work. There we go. Okay. So just pulling your nose up a little bit. I'm going to take a peek. Okay. That's great. I don't see any blockages. I do have the hiccups now, though. Excuse me. Okay. Now what I would like you to do is just take a deep breath in and out through your nose. Okay, great. Now I want you to occlude one nostril, okay? And take a deep breath in and out through the one nostril. Good. And the other side as well. Okay. Any struggles with that at all? Or are you breathing nice and clearly and normally? Okay, excellent. Now we're going to test your sense of smell. Okay, so I have some different essential oils I want you to sniff. Alright. You're not allergic to anything, are you? Great, okay. So here's the first one. Just take a deep inhale. See if you can identify that. Yes, that one was lavender. Very good. Okay. And the next one here. Take a few deep breaths in between to sort of cleanse your nose out of the previous scent. Okay. What does this one smell like? Take a deep inhale. What do you think? Cinnamon. Very good. Okay. And the next one. Alright. Take a good sniff of that. Tell me what you think it smells like. Yes, it was rose. Very good job. I would have taken any similar smelling flower, but you got it right on. Okay. What about this one? What do you think this smells like? You need another whiff? Okay. Yes, that one was fresh apple, actually. Surprisingly, some people struggle to identify that one, but you're doing very well. Okay. And this is the last one. Take a good inhale. You want another sniff? No, you got it. It's coffee. Very good. I feel like that one is pretty distinct. I love the smell of coffee too. Okay. So that is all we need to do for your sense of smell. Yes, we're going to move on to your mouth now and your sense of taste, okay? So what I need to do is take a quick look in your mouth. Go ahead and open wide and say ah for me. Good. Okay. Alrighty, I'm gonna break out my tools here. I just have a little mirror so I can get a better look. So open your mouth wide. Okay. I can tell you take good care of your teeth. I don't see any cavities. Okay, have you had your wisdom teeth removed? Alright, and how about your tonsils? Do you still have those? Okay, good. And just looking at your uvula in the back of your throat, will you say ah? Okay, excellent. And then just stick your tongue out for me. Great. Everything looks totally fine there. Now I have some different powders, some different substances I'm going to have you taste. Nothing unpleasant at all, but they're just flavored powders, kind of like pixie sticks. Okay, alrighty. Go ahead and open wide. Taste that. What do you think it tastes like? Orange. Very good. These are pretty tasty, I would say. Nothing nasty at all. Okay. Open wide again and say ah. Okay. What does that one taste like to you? Vanilla. Great. Very good. Okay. And the next powder. Stick your tongue out. What does that one taste like to you? chocolate. Very, very good. Okay. And then I have one more substance for you. Stick your tongue out. That one might be familiar. Yes, that is coffee flavored as well. So there was a coffee scent and a coffee flavor. We find that that is one of the easiest tastes and smells for people to identify because it is so very strong and so unique. Yes. Okay. Very good job. Alrighty, that concludes your in-depth, very detailed cranial nerve exam for today. I haven't noticed any problems at all. Your cranial nerves seem to be intact and very healthy. Do you have any questions for me at all? Any concerns? Okay. Well, if you're having some concerns about your vision still, I can set you up for an appointment for that. Okay. How does the 15th work for you at 3 o'clock? Great. Alrighty. Well, I will see you very soon then, okay? Perfect. Yes, you did very well today. You are a wonderful patient. Okay. Have a wonderful rest of your night. Thank you so much for coming into the clinic to see me today.